Patients undergoing gastroscopies and colonoscopies will often have very common questions. Here are some answers. What is a white diet? Well, firstly, a white diet is not just white food. In fact, it's typically just clear or light coloured foods that you're able to consume in the 2 to 3 days prior to your procedure. The idea is to try and provide the best possible preparation so that we have a very good view of your bowel during a colonoscopy. White foods that can be safely consumed include chicken and fish, but other foods that are slightly yellow in appearance may also be consumed. Butter on bread is completely fine. Having a banana is also okay. Other foods that you may consider having include clear jelly, which can be yellow or green. Just try and avoid things that are red or too dark in colour. Skins should be avoided, as well as seeds in the days leading up to the preparation. Ultimately, we should be aiming to have a yellow, clear discharge coming from the bowel with our final few bowel movements prior to the procedure. I am lactose intolerant. What food can I have during the white diet? Most lactose-free meals are completely fine as long as they are white or light in colour. Using alternative milk and alternative dairy products is completely acceptable. How does bowel preparation taste? Taking the bowel prep is definitely the most difficult part of the procedure, and often patients can find this quite a challenge. Bowel preparation can have a salty flavour and can be effervescent. Some tips to try and help you tolerate the bowel preparation better include drinking it through a straw so that it goes straight to the back of the palate, having it in small quantities throughout the bowel preparation process, having a boiled lolly to help remove the aftertaste of the bowel preparation, and having the fluid chilled can make it more palatable as well. Often it's advisable to make the bowel preparation in advance and leave it in the fridge ready for when you are due to consume it. How long does a colonoscopy and gastroscopy take? Both procedures are relatively quick. A gastroscopy takes about 5 to 10 minutes and a colonoscopy can take between 20 to 30 minutes. Overall, the procedure length can be up to 30 to 45 minutes, including the anaesthetic time. You'll wake up feeling slightly groggy, but otherwise not too different to how you were when you went to sleep. Why do I need an anaesthetic? In Australia, most procedures are done under sedation. This means that you are given medication that drifts you off to sleep just enough so that you are not aware of the procedure. You are still breathing on your own and you do not have a tube in your mouth to breathe for you. This means that you wake up very soon after the procedure and recover very quickly, ready to go home within half an hour to an hour afterwards. The procedure can be done without anaesthetic if you choose. Some people prefer this because they have a poor response to sedation or they would like to drive themselves home. If this is something you would like to consider, please speak to your proceduralist. Is it uncomfortable? A gastroscopy and a colonoscopy are both very safe procedures that cause very little discomfort. During the procedure, you'll be asleep and sedated and will be unaware that anything is occurring. When you wake up, you might feel slightly groggy from the effects of the anaesthetic. Occasionally, you might have a very mild sore throat or a little bit of abdominal distension or bloating. Both of these will typically settle within 24 hours. It is very unusual to experience any significant sharp pains, and if this occurs, you should consult with your doctor. Initially, you may try taking Buscopan to see if this aids with providing some relief. Can I go to the office the next day? Often patients will take the next day off work. Following sedation, it is advisable not to drive for 24 hours and also to not make any major decisions, including financial and work-related decisions. Depending on the line of work that you do, you may want to take the entire day off or at least take the morning off following the procedure. You should not be operating heavy machinery for 24 hours after an anaesthetic. How big is the probe? A gastroscope and a colonoscope are about the size of my little finger. They are both flexible tubes which can manipulate their way through the bowel, meaning that they do not cause much trauma or discomfort, both during or after the procedure. What if I have to go to the toilet on my drive to the hospital? It's actually not uncommon to need to make a stop on the way to the hospital. Ideally, by taking the bowel preparation early, you can have your last bowel movement before leaving home, but occasionally you may need to stop on the way. If this is the case, just be prepared and maybe plan to think about where you can stop if you do have a long drive. When you arrive at the hospital, the nurses will ensure that you get changed into a gown and will allow you to go to the toilet before the procedure to have one final bowel movement. The goal is to aim for a yellow, clear discharge from the bowel, which will ensure that your bowel preparation and your procedure are as effective as possible. How can I have a colonoscopy when I'm on my period? This is a very common question that we get asked. Having a period does not prevent you from being able to have a colonoscopy. In fact, it is very common that patients will arrive wearing a pad or a tampon, and this has no impact on the procedure itself. In this situation, it is often advised to keep your underwear on as you come into theatre, and this will be removed just prior to the colonoscopy. If you have any specific questions, please always feel comfortable asking your nurse or doctor on the day. Do I need a script for bowel preparation? Bowel preparation is available over the counter in Australia and does not require a prescription. You will be advised which preparation you should pick up leading up to your procedure, and you can walk into the pharmacy and be able to purchase this over the counter. What should I expect leading up to my procedure? At Gastroenterology Specialist Care, we have dedicated nurses who will contact you in the 24 to 48 hours prior to your procedure. They will run through the instructions with you to ensure that they are understood and go through any questions or concerns that you may have. You'll be advised if you need to stop any medications, including diabetic medications and blood thinners, prior to your procedure. But if you are unsure, please contact our rooms to ask. The instructions will be emailed to you or mailed if that is your preference, and we'll go through the lead up to the procedure. In the days following the procedure, one of our nurses will also be in contact. This will allow you to run through any concerns that you may have and also to ensure that your recovery is as expected. If you need to speak to one of our staff sooner, please get in contact through our rooms, or alternatively, if it's an emergency, please attend your local emergency department.